Come on, guys. Let's go to the KUM News Zoom room where we have Dr. Felix Cabrera standing by. Good morning, Doc.
Good morning, Chris. Good morning, Bree. Good morning, Jason.
How you doing this morning, Doc? How are you doing, Doc?
I'm doing great. Doing great. Hanging in there.
Right on. That you getting any of that? How was it? The COVID fatigue?
I can't complain because especially with the amount of fatigue that the persons working in the hospitals and extending themselves so much that really I can't complain.
Amen.
Given that compared to them and what they put up for us.
Amen. There's always someone more tired than us, and I'm pretty sure the frontliners are. You talk about fatigue, Doc, holding it together. So it's good to see that they're getting a little bit of breathing room with the decrease in hospitalizations, right? But let's just jump right into the CAR score. So right now it's 2.1. Is that the most updated figure that we have, Doc?
Yeah, from that was released on Monday night. Did not get recalculated last night because of the holiday, but should be updated this evening.
What do you anticipate it being this evening?
It's probably, in all likelihood, it's going to be similar. I don't think we're not expecting any surprises right now. So it's going to hover around there. It's going to be around 2, probably even lower than that if there's not too many differences. So we'll see.
Doc, what does it mean though, having the CAR score this low? I mean, obviously we have seen a reduction in the number of positive cases. So that being said, what is your read on the current COVID situation as it stands right now?
Well, again, thinking about what the CAR score represents, right? So it represents a lot of our actions and the decisions we made as a community, going 1 to 2 weeks back, even. And so right now, what that's telling us is that we as a community have made some good decisions, and we've adhered to the 3 W's and had the willpower to do that. And so that bodes well, I think, for us. And I think it is a good representation of what's really going on here in Guam in terms of community spread. Now, we're still trying to see what Thanksgiving meant in terms of community spread here. We thought that probably beginning of this week was the beginning of a good representation, and so far that's good. It's saying that for the most part we did do well during Thanksgiving, but it's still a little bit too early to say that with conviction. But so far it looks good.
What is the timeline that we would expect to see whether or not we were naughty for Thanksgiving?
Well, we want to think about it in terms of of incubation periods and so forth. So, if it takes about 5 days for you to show symptoms or to present yourself, and then you want to do several rounds of that. So, so you do 10 days, 15 days, something like that. So a 2-week marker would be definitely a point where we would see that, and that 2-week number would be toward the end of this week, actually, when we would actually get, good eyes on that. And if we continue on this trend, then that definitely does tell us, and it tells us with even better certainty that people did follow the governor's advice and really did their part to help strive for 5 and to get that CAR score below. And it matches up because by this weekend, if we remain below 5, that would be about the 2-week mark, the 14 days that we need to prove to the governor that we truly can, practice a major holiday here on Guam and do it responsibly. And so with that, hopefully that allows us a little bit more liberties as we go through the rest of this holiday season.
Doc, public health, they had their mass community testing with the Binax Now almost every day last week. And public health has said that, the turnout was kind of low. I'm looking at the numbers from yesterday that was released by the JIC last night. It was just 177. Are we seeing less people that are exhibiting symptoms, and that's why we're seeing such low numbers?
Yeah, I think that I think maybe public health they shouldn't be so hard on themselves in terms of saying that the community presence was low. They had a certain bar that they were willing to be able to do, and they knew that they had the capability to do. It doesn't mean that we have to do all of it on those specific days. But the way I would interpret is that they did enough. They did enough for us to show that we were doing a good sampling of the rest of the community. And again, this was not symptom based. This was open to everybody, and that was a portion of what the total tests were for each of those days. And so that had a good representation. There's a good mix of antigen testing and a good mix of molecular or PCR type testing. And so with that balance, it gave us we felt more comfortable that this is actually a better representation of what really is the prevalence in the community. So it served its purpose. It also allowed them to really work out a lot of the kinks in the process. And so that was very, very helpful in terms of with that type of testing and the different way that you get the results before you leave, and that's pretty remarkable when you think about it. So I commend them for the job that they did, and that it did help us understand things better. It gave us a little bit more confidence in the CAR score itself, that it was giving a good representation, because we look at the number of tests that are done per day also. And that's very important part. We want to try and average, especially when things were really bad, we wanted to try and average above 600 tests per day, with majority of that being molecular. And so we easily do that. Right now, we're like at 700 some, even with the only 177 reported yesterday. So I think that's going well.
Doc, when we had Janella on yesterday, she was talking about public health kind of retooling their strategy, not necessarily doing the mass testing the way they were doing it last week, but looking more at, I think she said, doing buildings, or they even floated the idea, well, she did yesterday on the show, of doing testing at the malls, maybe, since people are shopping and trying to capture where people are at. And then I kind of threw out the idea of doing it at night, but only because I feel like people are working and they might not have been able to go to the community mass testing. So which of those ideas do you think is the most feasible and the most likely to be stood up quickly?
So, with that, again, so that's specifically, again, the antigen testing part. And that's, again, it's a component of everything, of all the testing for the island. So it does have a role, and I love the idea. I know that they're engaging with the different shopping centers, malls, and trying to figure out a way to incorporate. And I think that's good, because it's always good that a portion of the test that we do daily is almost a random sampling, semi-random sampling, because it's people who can just walk up. The advantage of having it in the malls is that we reach these target groups that otherwise wouldn't have come to these screenings, where let's face it, they're the younger crowd in most of the time, and if they can just go there and find out within 15 minutes if they're positive, negative, then that's a good catch, because they're more likely to be asymptomatic, and they are the largest group in terms of who end up being positive on the island, so far. So any way that we can capture that specific demographic, I think, is really, really helpful. And we need to think about different ways. Again, antigen testing itself is really the most valuable when it's done on a repeat basis. Again, so the example being like hospital workers or college students at the college, where they have to get tested frequently. Maybe not everybody once a week, but a sampling of everybody once a week. Of the whole population, and doing that, that's where you start using testing as a preventative tool, as opposed to just a diagnostic tool. And this is the one way that we can really do it well.
So are you saying that we should just do away with this mass community testing because it's kind of like a one and done, or what?
No, what I'm saying is that we can incorporate it where it becomes more of integrated in daily activities in certain ways. So if you go to the mall once a week, for example, then maybe it's available there and you get your test once a week at that time. And so it just needs to shift in a way that's more accessible. I think that's the key part. And as you mentioned, I think part of the reason why they didn't get us numbers as they potentially could have was because it was during 9 to noon. A lot of people are at work, and so that was the part there that was a barrier. So doing it at different times is important. We know that, for example, contact tracing is much easier to do. You start calling around in the evening as opposed to during times when people might be at work. So, same concept goes with testing, and that's where we'll probably get a better, turnouts in those regards.
Are you involved with any of the planning for the vaccine distribution?
Yeah, so I've been, as part of the surgeon cell, we've been involved a lot, and of course, I understand you're going to have Annette Uggan on later, and she's going to be able to give you a lot of information. But yes, we've been very much involved in just understanding the logistics and operations and giving feedback on it as well. Part of what I've been asked to help with is also mostly the public education about the vaccines themselves, from a physician standpoint, of course, and try and ensure that if there's any misinformation that comes out, that we rapidly address it, and really do our best to help ensure that everybody understands the facts behind the vaccine. And so, I'm happy to answer any of those questions that may be on the clinical level.
Okay. So the vaccine's not necessarily for children?
So right now, it's not intended for those 16 and under, because they haven't been studied enough yet. In particular, the Pfizer vaccine is already starting the parts of the clinical trial where they are including 12 and under, for example. And so that will come, because that's an important demographic, obviously, and we all want to protect our children, but they always start out with usually adults in these vaccine trials first, ensure that safety, then they move down, down toward pediatric population from there. So no, it won't include those 16 and under. It won't include, it's not going to be approved for pregnant women or breastfeeding women, as I understand, as of now. But that may be changing as the clinical trials move forward.
Mm-hmm. So what about elderly? Is there a cutoff?
So the elderly, so there is no cutoff, but it is important to note that the trials in particular, and again, I'm using the Pfizer trial as an example, that they didn't include anybody above 85 years old in their trials. So there's plenty of 65 to 85, for example, and that were there, and the safety was equivalent to the rest of the trials. The efficacy was a tiny bit less, and that's just, usually then that makes sense for somebody as we get older. Our immune system is not the same as we were when you're younger. So it's a tiny, it goes from like 95% effective to like 94. So it's a very tiny difference, but there is no limit on age. In fact, we're be very happy to give it to those above 85. In fact, the first woman who got the vaccine outside of clinical trials in the UK was, I believe, a 90-year-old woman, and so she was the very first.
Mm-hmm. Dr. Ho Win, he's been saying that we should put patients with comorbidities on this list to receive the vaccine. But are there certain health conditions where you wouldn't recommend someone take the vaccine?
Right now, we're not seeing that. We're not seeing any specific health condition that prevents you, so that's actually a good thing. And just to keep in mind that some of the other vaccines that we know of, like the flu vaccine and some other ones where there's some conditions where you shouldn't take it, that doesn't apply to this particular the mRNA vaccine, because it's not made in the same way, and it's usually those other ingredients is why there might be an issue with some people, but not in this case. This case, there is no contraindication that we're seeing, except for the ones that we're just holding back because they haven't been studied as much. Again, pregnant women, breastfeeding women, and those younger than 16.
Mm-hmm. What about if you're on certain medications? Would that prevent you from taking the vaccine?
So far, not that we know of. There is nothing that seems to be that correlates with any adverse event. So it's very important to know that during these clinical trials, from the beginning and moving forward, there's an independent body who's monitoring the safety. So they're different from the actual manufacturers and the research and development. So they're separate, and they monitor that. and they basically, their statement is pretty clear, when they say that they don't see that there's any major serious safety concerns with these vaccines, especially on the short-term basis that they've been studying it over 3 months. The worst side effect that's been reported is actually only after that second dose, because you need, again, the 2 doses for the Pfizer and the Moderna, for example, that's several weeks later. And it's usually after that second dose, the most reported side effect is fatigue. And that's about 4% of people who get that second dose have some fatigue that lasts about a day. And then the second most common is a headache. And that's 2% of the people who get that. After they get their second dose, they get a headache. And then, of course, there's some soreness in the arm. And then there's some very few people who had, some body aches and things like that, but very, very, very minimal. So relatively speaking, when you compare this to any other vaccine, it's pretty good. And it's on par with a lot of the more common ones, for example, for like the flu vaccine.
Mm-hmm. Okay. Are you going to take it?
Well, as of right now, the answer is yes, and I don't see that there's going to be much that's going to come to fruition that's going to make me change my mind at this point, unless something major happens, given what's been reported so far. Now, the FDA will be meeting on December 10, which would be the 11th for us here on Friday, and then within a few days they're going to make their decision about whether or not to give an emergency use authorization. So we'll probably get that decision over the weekend. But at the same time, with that, we will also be watching very closely, because then other academics, can actually review the data themselves and then also have their opinion. So I'm actually looking forward to what they say as well. And of course, for example, Dr. Fauci, Dr. Birx, Dr. Adams, the Surgeon General, these are people that I think the whole country really want to hear from, and they want to know ultimately, are they going to take it as well? And so I think it's a safe bet if they take it that I'm taking it as well.
But if you've recovered from COVID and you've had COVID, would you need to take this vaccine?
So one is that if you have COVID, if you've had COVID, confirmed or unconfirmed, there is no guarantee that you have immunity with it. And so that's one of the key things. And we know that that's definitely the case, because there are many reports of people who have had the actual food disease more than once. And so if you are in these primary groups, like a healthcare worker, for example, and let's say you had COVID back in June, then you should definitely be getting the vaccine. That shouldn't change any, shouldn't change whether or not you qualify for the vaccine, because we just don't know, and in all likelihood that immunity that you may or may not have developed could, likelihood be gone by now. What we think is that this vaccine itself is going to probably provide even stronger immunity than getting the disease itself. At least that's what initial thoughts are, especially with the booster part, that second dose.
Mm-hmm. How far apart is it between the first dose and the second dose?
So for the Pfizer one, the first one that we expect to come out, that's going to be about 3 weeks, so 21 days. And then the Moderna one is 28 days. So you just have to get it after that. There is no cap on how late that we know that you can take the second dose, but you just can't take it earlier than that set date, number of days.
Mm-hmm. Do you recommend that people, if they're working, if they take the first dose and they start feeling side effects, should they stay home from work or?
Yeah, so that's a really good point, Bree, because that's something that we actually are considering. So what we have to understand is that, instead of thinking of this as reactions, these are immune response. We're training, right? And so if you're gonna try and train for a marathon, you're gonna have to run some 5Ks and you're gonna get sore the first time you do it. And so you have to have a certain expectation for that. And one thing that we have to be very clear about, you cannot get COVID from this vaccine. It just does not work that way. It doesn't work that way. You're not getting COVID. You're getting a tiny fingerprint of COVID, basically. It's like trying to say that you can make a human body by the fingerprint. You just can't do that with this. So just have the expectation that you're going to have some of these side effects. In fact, there's even some recommendations is to consider the flexibility to take the day off after your second dose. if you're not feeling well, if you're feeling too fatigued. And that the problem is that some of these can be considered COVID symptoms, overall, and it could be and let's just face it, there are going to be some coincidental cases where somebody's actually has COVID or is about to have showed their symptoms and they just got the vaccine, and it ends up being coincidental. So that is going to happen. We have to, the odds are just there. So, but having these other expectations about what is the most likely process is that, that this response, just means that it's working, and you should be happy, because that's going to, imagine what you will feel if you had COVID, be so much more, so much worse instead.
So I'm sorry, these guys are showing you video, so I kind of lost my train of thought. So did you say that after the first dose, it's okay to go to work?
Yeah, absolutely. It's definitely okay to go to work. And again, any of the response symptoms are even less likely after the first dose. It's usually after the second dose is where you're more likely to get some of these responses. But again, very low. About 4% or less have any symptoms.
Mm-hmm. So again, you can't catch COVID after you take that first dose, between the first and the second dose.
What I want to be clear is that the vaccine itself doesn't give you COVID, cannot give you COVID. But there is the possibility that you may still catch it just from the community, right? Because you are likely not that have fully built immunity between those two doses. In fact, they only started testing the immunity 7 days after that second dose. So that's what the trials actually looked at specifically. And so in understanding that, and again, it's 95% effectiveness, and that's very, very high. But that means for every 100 people, 5 of them are gonna still be susceptible to COVID to get it naturally. And so, but we have to remember the World Health Organization basically said if we had a vaccine that was at least 50% effective, that would have been good enough to really eventually lead to the end of the pandemic. So to have something that's 95% effective, we basically can't ask for anything better when it comes to vaccines.
Right. Yeah.
In all reality.
Yeah, I just asked that because if the frontliners are getting the vaccine first, right, and between the time from the first dose and the second dose, how are they going to be able to work during that time frame? So that's just, I was just curious about that.
Yes. So the key thing that we absolutely have to understand here, and this is probably the most important point I hope to make this morning, is that the vaccines are a long-term preventative measure for the community, long-term. Our 4Ws is still our immediate preventative method, right? So washing your hands, watching your distance, wearing your mask, and having the willpower to do it all the time, even if you got the vaccine. So that's the key part there. And we know this very clearly that even looking at as we move forward through all the way till spring into April, that masks are still going to be way more effective than the vaccine in terms of halting community spread. So it's not until maybe past April, and that's with an aggressive vaccine program throughout the country, is that not until into spring will the vaccine start now having more of an impact than masks. And that's a long time from now. So that's a key point that we have to really understand, that this is only the beginning of the long-term solution. And it's going to take a while before that long-term solution is fully put in place. So until then, we still do what's the most effective, which is, again, our 4Ws.
Right. Doc, so let me ask you this, right, because there's people who are going to look at these numbers, all 7 positives. We've seen the decline in hospitalizations. I know there's people out there who are saying, oh, it's over.
Well, let me say this, is that right now, they're still continuing to do seroprevalence studies, which is basically saying, about how many people have actually gotten COVID in certain states. Unfortunately, Guam wasn't one of them, but they included like Puerto Rico and DC. But, the state that has the highest percentage is New York, with about 21% or more, or a little bit more. That means that still, and then most places are in the single digits, less than 10%. That means that a majority of the country, there's still 90% people who are still susceptible to it. So there's no way that this can be gone, and that it's still very much a threat and there's still basically a huge pool of potential spreaders or people that can get infected and spread it to others. So we could see another August, September, October very easily here on Guam in the next 2 months. We could see that same thing happen, if not worse.
Right. One question from our viewers. How about cancer patients? Can they take the vaccine?
Yeah, and so right now there's nothing that appears to preclude them from getting the vaccine. And in fact, they're probably the ones that we would definitely want to have vaccinated. They'll be higher on the list. In particular, they have active cancer disease or are receiving active therapy that suppresses their immune system. Just because you have one medicine that suppresses your immune system doesn't mean your whole immune system doesn't work. We use the other side that's probably going to still work to make the vaccine. So they'll be on some of the higher priority lists. But again, that priority list is being made, and it's a flexible list. But right now, what's clear is that it's going to be healthcare workers, those in nursing homes, and then of course the frontliners as well. And in likelihood, that order is how they're going to be given out. And then from there, it's going to be flexible based on what the number of vaccines we have available.
All right, Doc.
Thank you. Was there anything else that you wanted to make sure people knew about with this vaccine before we let you go?
No, I think that's we'll continue to watch it very closely. The safety of our people is number one, right? But we cannot make perfection the evil of good. And so this is not going to be a perfect vaccine. This is not going to be a perfect rollout. None of this is going to be perfect, but we can't stumble ourselves over that part. And we have to accept that we have to take steps forward. We have to take certain risks, especially when the benefit is so potentially large. And so with that, I know that there's still a lot of people that are hesitant about it, but I promise everyone here on Guam and everyone who can hear my voice is that I will get this vaccine when I feel fully confident, and when I feel confident that even I would recommend it for my own family. And if you see that, then I think that hopefully will be a good endorsement. And that I know the ramifications if I do and if I don't, and I want to ensure people that I have everyone's interest in mind, and that myself and many other healthcare providers, like other physicians and of course the governor, lieutenant governor, they're along the same mindset. And so we want to ensure that this is done responsibly and done effectively.
Thank you.
Thank you, Doc.
Yeah, thank you, everyone.
And happy holidays if we don't see you. Merry Christmas.
Thank you. Happy holidays too. Take care. Thank you for everything you're doing, and stay safe.
Of course,
Thanks.
Doc. Take it easy. Dr. Felix Cabrera of the Physicians Advisory Group. Guys, we're going to jump in. We have a few minutes here to share